So, hello students, and welcome back to the clinical case discussion of thorax. Come to case number 2. Let us have a look at this. Okay, a 52 years old woman undergoes pleural aspiration. Immediately after the procedure, she becomes tachycardic. Tachycardic is increased heart rate. Percussion. Percussion is stony dull on the same side, and her hemoglobin drops. So when we percuss that area, it is a dull note. Dull note, normally it should be a resonant note when we are percussing on the lungs, in the intercostal spaces. Now it is a dull note. That means something has filled the space and the hemoglobin drops. So students, pleural aspiration is going on, a procedure to remove the pleural, the accumulation of fluid in the pleural cavity. Effusion we call it as, and we are aspirating the effusion, and while aspirating the effusion the person becomes tachycardic. There's dull note on percussion and the hemoglobin starts dropping. What do you think? Why is the hemoglobin dropping, students? Looking at the question, can you come to some conclusion? The hemoglobin is dropping. That means some vessel is pierced. That means the person is bleeding. The hemoglobin starts to drop down. Okay, dullness is because of accumulation of blood in the pleural cavity. Normally there's air, so now there's accumulation of blood, so there's a dull note on percussion. So what is this complication? We are trying to drain the aspiration. The blood vessel is pierced, the blood vessel starts to bleed, and the blood collects in the pleural cavity, in the thorax. This is what we call as hemothorax. This is what we call as a hemothorax. Okay, this is what we call as the hemothorax. Fine. Which vessel is likely to be injured and why? Now, what do you think, students? What do you think? Look, this is a rib here. That's a upper rib. This is the lower rib here. So, this is the upper border of the rib. That's a lower border of the rib. On the lower border of the rib, there's a groove. What is this groove known as? The costal groove. Okay, that's the costal groove. And how the structures arranged in this costal groove? The structures are arranged as vein, artery, and nerve, right? You know this vein, vein should be, sorry, the vein, artery, and the nerve. Vein, artery, and the nerve. Fine. So these are the structures in the intercostal space: the vein, the artery, and the nerve. Fine. This is fine now. So vein, artery, nerve lie in the intercostal space, where along the inferior border of the rib, in the costal groove. In the costal groove. So the rib inferior border has a costal groove, and what are the structures lying here? Vein, artery, nerve. The sequence is vein, artery, nerve from above downwards. It's vein, artery, nerve from above downwards. Now this sequence is reversed in which rib? The first rib, right? This vein, artery, nerve sequence is reversed in the first rib. So normally when we put a needle to aspirate the effusion, where are we supposed to insert the needle? We are supposed to insert the needle along the upper border of the lower rib. Along the upper border of the lower rib. So this will prevent injury to the intercostal nerve. This will prevent injury to the vessels also. Fine. So clear to all of you? What was the question? Have a look. So which vessel is likely to be injured and why? So which vessel is that? The vessel is the intercostal vessel. Artery or the vein is ruptured. Why? Because the needle must have been placed along the lower border of the rib. If you place the needle along the lower border of the nerve gets injured, the vessel gets injured. Fine. What is the next question? State the correct needle entry rule relative to the rib. So where are we going to place the needle? We are going to place the needle along the upper border of the lower rib. Upper border of the lower rib. Are you getting this? So that's the upper rib, that's the lower rib, that's the intercostal space. We insert the needle along the upper border of the lower rib. In which muscular plane does the intercostal bundle run? Okay, so now students, you know we have got three muscles. We have got three muscles. One is the external intercostal. The second is internal intercostal, And the third muscle, for all practical purposes, we call it as innermost intercostal. For all practical purposes, innermost intercostal. Fine. So external intercostal, internal intercostal, and innermost intercostal. So where do the nerves and the vessels lie? The nerves and the vessels would lie between the internal and the innermost intercostal. This is what we call as the neurovascular plane of the thorax. So the nerves and the vessels lies between the internal and the innermost intercostal. Fine. That is what we call as the neurovascular plane of the thorax. So in one sentence, if I have to summarize this MCQ, the neurovascular plane of the thorax lies between the internal and the innermost intercostal in the costal groove along the inferior border of the rib, and the sequence is vein, artery, nerve. Now this sequence is reversed in first rib. Vein, artery, nerve sequence is reversed in first rib. Fine. Clear to all of you? Okay, look at this MCQ. The intercostal neurovascular bundle in a typical intercostal space is arranged from superior to inferior as. So options are given A, B, C, D. Students, make it a point to answer this MCQ in the comment box. We have already discussed everything about this intercostal space. So this MCQ will be very easy for you to answer. Definitely make it a point to answer in the comment box. Fine. So students, this is clear to all of you. A very important clinical case wherein aspiration of the pleural fluid is done and where the needle is to be placed, what is injured, clear to all of you, and the neurovascular plane of the thorax. Okay, I hope this MCQ is clear to all of you. Students, make it a point to see the entire series, the case discussion series of the thorax. That will help you, that will boost your confidence and help you to answer all the clinical questions of thorax. Thank you so much.